Okay, so I'm back with another topic of pediatrics, and that is intussusception. So, how will we see a child with intussusception in our emergency department? So, he will present with episodes of screaming and drawing up of legs, and the child will appear pale. And between episode attacks, the child will be listless. You can say non-alert, and there will be bilious and conspicuous vomiting. There will be red currant jelly stools, which are basically the blood stained mucus with stools on diarrhea. And on abdominal examination, there will be a sausage shaped mass or lump in the umbilical area, and there will be a feeling of emptiness in the right iliac fossa, and this is called as a sign of dance, and it is specific for intussusception. And most common site or most common type of intussusception is ileocolic one. Okay, so these were some of the important points regarding it. So now let's take a look at how will you investigate a case of intussusception. So you'll order a plain abdominal x-ray which will show target or meniscus sign. Ultrasound abdomen will be done, which will show a kidney shaped mass in longitudinal view and a target or bullseye sign on transverse view, and this is diagnostic of intussusception. Then you will do a barium enema, which will show claw sign, and it is the most sensitive one for intussusception. And a CT scan will show a sausage shaped soft tissue mass. So these are the important investigations for intussusception. And how will you treat such child? You will admit the child in hospital, and you will do the initial resuscitation, which will include IV fluid therapy and antibiotics and nasogastric drainage. And first non-surgical treatment option will include hydrostatic or non-operative reduction by contrast agent or air enema. And then the surgical option, if the enema fails, then we go for surgery, and the surgery will include ileocolectomy and primary anastomosis. And we will do surgery when the hydrostatic reduction fails for the third time. We'll do it 3 times, the hydrostatic reduction, and if it fails for the third time, then we go for surgical treatment, because then it will just the gut will go into ischemia and necrosis, and it will be further dangerous for the remaining viable gut. So that is why we'll just go for surgical extraction. So these were some of the important points of intussusception, that the child will present with episodes of screaming, drawing up of legs, and there will be episodes of conspicuous vomiting, red currant jelly stools, sausage shaped lump in the umbilical area, and feeling of emptiness in the right iliac fossa, called as the sign of dance, and the most common type is ileocolic intussusception. Okay, and the investigations include plain abdominal x-ray showing target or meniscus sign. Ultrasound abdomen will show kidney shaped mass on longitudinal view and target or bullseye sign on transverse view, and this is diagnostic. Okay, and barium enema will show a claw sign, and CT scan will show a sausage shaped soft tissue mass. And the treatment will include hospital admission, resuscitation, IV fluid therapy, antibiotics, NG drainage, and hydrostatic or air enema, and surgery in case of failure of the hydrostatic enema for the third time. So these were the important points regarding intussusception. I hope it was helpful for you guys. Thank you so much for watching.